presentation, we'll look at the passive tissue components of movement. We'll determine the functions of individual components of the musculoskeletal system, those being blood, bone, cartilage, ligaments and tendons. A typical long bone muscle joint complex consists of a blood supply, bone, cartilage, synovial fluid, muscles, tendons, ligaments, proprioceptors, fascia and nerves. And the mechanics of this arrangement of the component parts of this structure are adapted to aid force transmission for locomotion by merging linearly from muscle cell level through secure attachment to the associated bone, as neatly defined by Perslow in 2009. The equine foot is a good example of the presence of virtually all of these structures except muscle in one relatively small region, and this is a median section through an intricate mature equine foot showing bones, 4 bones, 1, 2, 3, 4 with the navicular bone, their joint lines, flexor tendons, superficial here, deep here, and 2 ligaments here and here, representing a supreme biomechanical force transmission strategy. Let's take a look at the passive structures individually. The role that blood plays on working muscles is to nourish the tissue with oxygen for energy production and removing the metabolites produced by that energy production, and bathe it with warmth for pliancy, permitting contracting and lengthening of muscle for joint action. The function of locomotor muscles and joints is restricted when blood flow to them is restrictive. And compressive load instantaneously results in an interruption of blood flow and a generalized restriction of circulating blood, either superficially or deeper. Depending on the blood vessel type that is affected and its ability to resist excess pressure. Progressive back muscle function is produced by the training and conditioning process and in turn muscle development, and it will be impeded by insufficient tissue nutrition delivered by blood vessels. And you can see from this image of a horse's back, this being the wither region, there is saddle panel shaped atrophy from a saddle not providing adequate protection from the rider weight, or the saddle tree. Bone occurs in a wide variety of individual shapes and sizes. They are sited in their respective positions within the skeleton according to their protective or mechanical locomotor roles. In a mechanical role, a series of complex interacting levers formed by bones either side of a joint facilitate movement. They are entirely passive, as I've stated in earlier presentations. Requiring input from the neuromuscular system for motion at participating joints. So, for example, this is the vertebrae, in the gullet of a saddle and showing a series of complex interacting levers which require space for adequate range of motion in order to support and stabilize the spine. In recent times, we're now seeing malformation of the cervicothoracic and thoracolumbar joints. Here's the thoracolumbar joint, observed in the modern sport horse by anatomist Sharon May Davis. And this is Sharon May Davis's specimen, and I've marked some lines on it to make the asymmetry clearer to you. You'll see in this region that there is additional bone here. Veterinarian Dr. Anne-Marie van Gelder in Holland has found these severe malformations of the cervical facet joints on dissection, whereby the articulating surfaces are so malformed as to be functionally incomplete. Personally, I came across a case of transitional last rib in a sport horse that I had dissected. This is a normal lumbar vertebra. This is an abnormal or malformed vertebra with the last rib. This is mimicking the transverse process of L1. You can see there is signs of a rib there, but lateral extensions, bony extensions, to enable it to perform more like the lumbar vertebra. And it's actually fused where it should normally be a rib joint. We have to remain open to the view that increasingly more horses may be carrying these abnormalities without us even knowing. Certainly in the cases of cervicothoracic malformations, affected horses can show signs of marked discomfort and postural asymmetry from the lack of musculotendinous anchor points for normal joint function. And this structure should look like this. With similarly shaped vertebrae. It's important that we remain vigilant for these types of abnormalities so that the horse does not get the blame for their inability to perform, and certainly to use any gadgets such as draw reins on these affected horses would be torture for them. Cartilage is a layer of smooth, microscopically spongy, shock-absorbing cartilage which mediates between articulating surfaces within the joint capsule. And the thickness of it depends on the stress to which it is normally subjected. It requires an optimal warm-up time prior to becoming fully functioning in a protective role, intrinsically when infused with blood, and extrinsically when infused with synovial joint fluid, which is an oil-like substance. And this image shows the smooth, glassy, cartilaginous surface between the long and the short pastern bones. The concave surface meeting the convex surface. Ligaments attach bone to bone to aid control and support of joints. They have minimal elasticity of only some 4% throughout their length, and a characteristic is that they are almost entirely passive, yet they are rich in dynamic mechanoreceptors providing intrinsic information relating to joint positions. And you can see from the sacroiliac joint here, there was more ligamentous attachment, but you can see clearly that this is a good example of how bone attaches to bone. Tendons are the muscle attachments to bone. They transmit muscular force to the lever systems of the skeleton and are comparatively strong and unable to contract. Elasticity is limited to some 10% in a crimp pattern of the resting length and is dependent on integrity of the crimp pattern, giving it capability of recoil. And the attachments are classified as either origins or insertions. Origins typically the fixed end, usually closer to the centre of the body, and insertions are typically the moving end, usually furthest from the centre of the body. The blood supply to them is very limited, which compounds healing when injured. This image shows the deep flexor tendon sited against the fetlock joint here, and this is with the tendon sheath open. In the next presentation, we will look at the dynamic tissue components of movement.